Dengue fever is viral infections. It is common in tropical countries, especially Southern Asia and Africa. The most common and important symptoms include high fever, which has sudden onset, headache, which is retroorbital, which means headache behind the eyes, muscle and joint pain, which means myalgia and arthralgia, maculopapular rash, which is small red bumps on the skin, which is not filled by fluid. Dengue fever has three phase. First phase is febrile phase. During febrile phase, these symptoms occurred, especially fever is high and it lasts 2 to 7 days. Febrile phase directly can transit to recovery phase, but in worst case scenario there is critical phase. Critical phase is a phase of complications like bleeding, plasma leakage, bleeding from nose, for example, or from gum, plasma leakage, and internal organs failure. For example, sometimes liver failure or kidney failure. Causes of dengue fever is a virus which has 4 serotypes and it is transmitted by mosquitoes, which is called Aedes mosquitoes. Mechanism of action, how dengue fever acts, it replicates in the cells and it avoids immune system, and sometimes immune response can cause lymph leakage and bleeding. So virus itself does not cause lymph leakage or bleeding, but immune system response does. Diagnosis is based on symptoms. Symptoms should be fever and plus 2 or more, severe headache, retroorbital pain, pain behind the eyes, myalgia, arthralgia, and rash. Leukopenia and thrombocytopenia is common. Especially thrombocytopenia is hallmark with which we can differentiate it from other diseases. So thrombocytopenia here is important, and thrombocytopenia also plays a role if severe complications occurs like bleeding. Laboratory confirmation of dengue fever virus is possible and by serology or PCR test. Incubation period of dengue fever is 3 to 14 days, but usually it's 10 days. So if person recently traveled on such countries and now he or she has high fever and symptoms, we can suspect on dengue fever also. Treatment. Most important treatment is rest, hydration, and fever management with acetaminophen. There is no specific treatment, there is no antiviral treatment, just acetaminophen. And here is important that not to use anti-inflammatory non-steroidal drugs such as aspirin and ibuprofen, because they can increase risk of bleeding. Intravenous fluid and pain management, and sometimes blood transfusion also important if complications occur. Complications can be severe bleeding, plasma leakage, which can lead to shock or organ impairment, severe organ impairment, neurological complications such as encephalitis and meningitis. Now what about immunity and vaccination? We have vaccines, but we have no vaccine. We have no universal vaccine for all serotypes, and it's important because even if person has immunity for one serotype, it does not automatically mean immunity for different serotype. And moreover, if person has antibodies against one serotype, it can have more severe infection from other serotype. That's why There is no universal vaccine, and there is no vaccine recommended for every person universally. It is recommended specifically for specific regions and specific age groups. Usually, complications higher in children under the age of 15 and people who already had dengue fever and now are infected with different serotypes. So if person already had one serotype, he or she does not have second infection with this serotype. If second dengue occurs, it means he or she is infected with second different serotype. That's all. Thank you very much. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.